Hello, everyone, and welcome to the next installment in our series, Dr. Gilbert Hosts. My name is Dr. Rebecca Gilbert, and I am the Chief Scientific Officer at American Parkinson Disease Association. Thank you so much for joining us today. I am very excited about today's guest, who's with us, Dr. Britt Stone. Dr. Stone is an assistant professor of neurology at Vanderbilt University, and we will be talking to her today about a topic that I know many of you want some more guidance about, and that is complementary therapies for Parkinson's disease. Dr. Stone will give a brief overview of this topic, and then we will be taking your questions. American Parkinson Disease Association, or APDA for short, is the largest grassroots network dedicated to fighting Parkinson's disease and works tirelessly to assist the more than 1 million people with Parkinson's disease in the United States live life to the fullest. Please visit our website at apdaparkinson.org to explore all that we have to offer. You can also contact APDA through our toll-free helpline, 1-800-223-2732, as well as via our social media outlets. And now I would like to formally introduce my guest. Dr. Britt Stone is an assistant professor of neurology in the Movement Disorders Division at Vanderbilt University Medical Center. She attended Vanderbilt University and Meharry Medical College for university and medical school, respectively, after which she completed her neurology residency at University of Pennsylvania and her movement disorders fellowship at NYU Langone Medical Center. Dr. Stone's clinical interests lie in construction of multidisciplinary clinics for Parkinson's patients and incorporating integrative medicine, particularly herbal medicine, into her treatment plans for her patients. She strives to use both Western medicine and complementary medicine approaches to provide the best care. I am very excited to be talking with Dr. Stone today. Dr. Stone, welcome, and thank you so much for joining us.
Thank you, Dr. Gilbert. It's a pleasure to be joining you today, and I'm very excited to get to talk about something that's very near and dear to my heart.
Thank you so much for being here. And could you tell us a little bit about what sparked your interest in this topic?
Absolutely. So I would say moms are always right. So my mother actually, when I finished my residency, said, you should really think about doing an integrative medicine fellowship. At which point I was like, Mom, I'm done with all of my training and I'm tired. And she said, well, I just think that would be a really good thing for your patients. And I kind of filed that away. And then kind of on my own, as I did my own health journey and did more reading, I thought, well, Mom might be right. And then the pandemic kind of gave me this opportunity. I did an herbal medicine course during this time of the pandemic when I was living in Austin, Texas, and then kind of made some connections with acupuncturists and people doing Chinese medicine in the Austin area. And the light bulb kind of went on for me that this would be something that would be good to investigate and be able to marry with the Western medicine that I already had been trained in.
Fantastic. So we're looking forward to hearing all about that and looking forward to your overview of our topic that you can take it away, Dr. Stone.
You've got it. So I think the first question is, what is complementary medicine? And the definition is that it's non-pharmacological treatments. So that means kind of not your drugs you're getting that are prescribed at the doctor's office that can complement and enhance traditional therapies. There are a host of kind of categories in this and some examples of complementary medicine that we're going to do a bit of an overview here and stay at this slide for a bit. I'm going to now break through for you. So one major category is exercise and movement. So pretty much anyone with Parkinson's knows that it's very important to be as active as possible, that movement and exercise are actually things that can help slow down progression of disease. And we really are kind of interested in the things that make you happy, the things that get you moving more than a particular sort of movement you need to do. But there have been studies in particular types of exercise and movement that I actually have listed here. So there's boxing. A lot of people are involved in Rocksteady. A lot of people are involved in just kind of local boxing classes at home. There's also dance. That could be, partnered dance. It could be Western dance, two-stepping, waltzing, salsa and bachata. There's also yoga, which there are many types of yoga. There are kind of more intense types and then more stretching focused. the Pilates and Alexander technique, Tai Chi and Qigong, and then also martial arts. And there have been studies for each of these types of movement modalities that have shown that in many ways, the key is getting people to move, to have some sort of high intensity exercise where you get your heart rate up, you break a sweat, you connect with other people, the social aspects of that being really beneficial for people with Parkinson's disease and really any of us in general as well. And so that is the first place, is getting moving. Then there's also mindfulness techniques, meditation, which, you know, people hear this and they sometimes go, oh yeah, like that sounds great. Or they hear it and they think, well, this just sounds like something kind of woo-woo and I'm not interested in it. But really, when we talk about meditation and mindfulness, it is time to kind of clear the head. That could be prayer. That could be walking or sitting in nature, hearing a stream or watching the sunset, just kind of being without having to really pay attention to your thoughts. And having time of silence and contemplation is huge for mental health, for helping control kind of, you know, the blood pressure, the heart rate, anxiety, and just being able to kind of decompress from all the things that are going on in our day-to-day. There are also manual practices of acupuncture and acupressure, which are well known in the Chinese medicine world. You know, there's this kind of philosophy of energy called qi that moves through the body and really kind of enlivens the body and allows things to move the way they should. And that sometimes this qi can be stuck or can be delayed in getting to the place it needs to. And then this can be correlated to issues that you have in the body. And so acupuncture and acupressure can be things that are really helpful for a host of non-specific kind of symptoms like fatigue, constipation, allergies, insomnia, chronic pain, anxiety and depression, and massage, because who doesn't love massage? Also, you know, we often suffer in a world of not having enough kind of meaningful therapeutic touch. You know, if you don't have a partner or a child or a pet, you might not be hugged very much or touched very much. And to have kind of a dedicated time where someone focuses in on therapeutic manipulation of your body, that helps for muscle tightness and spasm, which is really common in Parkinson's, and also for anxiety and stressors and chronic pain. And then we can't forget creative pursuits, because we are not just our bodies, we are our minds, we are social beings. And there's some very practical reasons why things like singing and music and dance and theater and art, you know, creating are therapeutic, but also it's getting in touch with that aspect of play that we often move from when we get older. In addition, it's also getting us connected to other people, to things in ourselves that we're trying to learn. It's just kind of a way to realize that you're a whole person and that you can learn something new as long as you're here. So now, what is integrative medicine? So integrative medicine is a clinical approach that focuses on treating the whole person with evidence-based practices using complementary therapies in combination with standard therapies. And that's really just kind of a specific definition that says we want to approach a person, mind, body, and soul. We want to make sure we're using things that have been validated by research and by evidence and not just, you know, things that are kind of a hunch. And we want to be able to marry things that we know have worked tried and true for years with standard therapies that we use in the medical field already. So what are evidence-based practices? So that is the integration of clinical care of medical practices supported by clinical trial data. And this can be hard in the world of complementary and alternative medicine. I think in large part because these things are things that we kind of intuit, like surely moving around is helpful for people who are stiff and slow, right? Like, but we need to do a study for that. Do we need to do a randomized controls trial where we have people who don't move and then people who do move in these certain ways and then compare the risk and the benefits? And then you have all these risk factors or these confounding factors of what if someone also has, you know, vertigo or orthopedic issues like arthritis in their knees or a bad back or something else that is in addition with their Parkinson's disease. Like how do we parse out these different factors to be able to get really good research data that then reinforces, oh yes, we can say this thing does help the end goal. And so, when you think about how to use evidence, and that's both in the therapeutic modalities we've talked about before, but also in herbalism, it can be very fuzzy. And I'm going to just talk a bit now about some of the herbal medicines that have been kind of tested in Parkinson's disease, and then some things I found to be helpful for a lot of non-specific symptoms in Parkinson's, and how to think about this moving forward. So the first one is mucuna pruriens, and this is the Latin name for the velvet bean, which is actually one of our naturally occurring sources of levodopa that grows from the ground. It can be found in health food stores, but there's no standardized kind of production of this plant and then this compound that's found in stores in supplement form. And because of that, it can be hard to then prescribe it appropriately to a patient, because it's not like Cinemet where, if you have a pharmaceutical that is prescribed, the FDA approves it, it has to be within a certain amount of standard deviation, too much or too little, a very, very narrow margin of what is allowed to be error, to then prescribe to a patient. So then that when you take this tablet, you're going to get 25 milligrams of carbidopa and 100 milligrams of levodopa, plus or minus maybe a little bit off on every pill you get. And you can't say that for a supplement. And so that's why if people ask, well, can I just take this instead of taking the Cinemet tablet? We would encourage people not to do that, because it's just not as tried and true. To that end, though, I've had some patients who have been very interested and they haven't had a lot of symptoms and they really wanted to try it. And if they weren't going to take a medicine at that point anyway, then I say, you're welcome to give it a try and see if you get a benefit. And for some people, they've noticed nothing. For other people, they've said, I do think it helps a little. Whether that's placebo or not, it can be hard to tell. My next slide is some examples of herbal treatments for Parkinson's disease. And so first, as a disclaimer, I'm not going to be telling you this is the dose, this is the formulation. It's more of just these are plants that we know have been beneficial in these various symptoms because they've been used either historically in the indigenous groups or in Ayurveda or in Chinese medicine or even in just herbal medicine throughout the United States for years. Or there have actually been studies that have been shown that it could be beneficial. And the majority of the plants that I have on this list are plants that, as far as we know, have not had negative effects with medicines for Parkinson's or have been dangerous to ingest from a personal standpoint. In addition, a lot of them have been used in tea form, and you can find them in your grocery store. So it's kind of as a dietary supplement more so than thinking of it as a prescribed compound. So there's sleep. And we know for sleep, we have chamomile, and everyone, I'm sure, has seen chamomile tea, both in, I think, by itself and in the sleepy time, kind of compound form. There's also passion flower, valerian root, and skullcap. And all three of these have been shown to help with sleep, particularly when the insomnia is triggered by things such as anxiety or nervousness or kind of a racing mind. One thing that's interesting is that for chamomile, there have been 2 controlled studies for sedative effects that have shown that it does have benefit with rare downsides. Very few people have had an issue with chamomile unless they're allergic to it. And of course, you can be allergic to any sort of plant. So there we are. For passion flower, there was another trial that was done between passion flower and parsley to see if people got benefit in that regard. And it seemed that passion flower was also helpful, particularly for managing some of the anxieties you could have when you're about to go to sleep, or that anxiety when you wake in the middle of the night and then can't get back to sleep. For memory, there is rosemary. For some of my people out there that love Shakespeare, in Hamlet, Ophelia quotes about rosemary being for remembrance. And this is an herb that's been used since ancient Greek and Roman times. Students used to actually inhale the aroma of rosemary before they'd study for a test. And there have been trials that have shown that rosemary can help with short-term recall before people who are taking exams. There's also the lion's mane mushroom, which has been used for years in Chinese medicine. It actually looks like a brain. It's kind of white and fluffy, and if you cook it, it tastes like a shellfish, like lobster or crab. So for those of you who have a shellfish allergy, it's pretty cool that you could have a replacement for that. That also has been shown to be helpful in actually what we call neurogenesis, which is kind of development of new nerve cells and helping to support the nervous system. In mood, we have lavender, lemon balm, and blue vervain or blue verbena. I think most of us have seen lavender everywhere in sprays for pillows, in essential oils to diffuse, in candles, and in bath oils. So we know lavender is really great for calm and relaxation. Lemon balm and blue verbena have also shown to be quite effective as well. And then muscle spasms. So we have arnica, which I'm sure many of you have seen in the over-the-counter area of pain relief in your local grocery or drugstore. Juniper, which is an evergreen, and in the South, well, particularly in Texas, is called cedar. And it has been very helpful, kind of an anti-inflammatory, and can be used topically for muscle spasm and pain, and even for people who have some arthritis. Valerian and skullcap kind of operate in two places, which is pretty interesting, both muscle spasms and relaxation of muscle and sleep. And then nausea and bloating, because we know the GI system is often impacted in Parkinson's and people have slowness through the gut. Ginger is great for helping with digestion and for nausea. Nutmeg and any of kind of those herbs that are great for kind of seasoning your food. Garlic, peppermint, rosemary, sage, thyme, even cayenne pepper. These all are things that kind of help jumpstart the GI system to digest more effectively. And so in lots of ways, when you think of plants, you want to think of them as working in synergy with your body and kind of helping support what your body's doing. And you can start really low by just eating and incorporating them into your diet before you think about having to take them in a pill or a tincture form, and seeing how that starts to make you feel. So one other plant that everyone has been asking about for the last, probably almost now 7 to 10 years is marijuana and medical marijuana. So marijuana is something that's kind of, I guess you could say, jumped the shark, in large part, kind of for a bit of history. In the 1960s, there was this huge breakthrough and a lot of research in drugs, particularly what we'd call maybe psychedelic drugs. And that would include kind of, the magical mushrooms you've heard about and hallucinogens and marijuana. And then kind of in this reaction, we had this war on drugs that really kind of quashed a lot of the clinical research that was being done in a lot of these substances, particularly in psychiatry and neurology. And so then we had a bit of a freeze. And now we're just kind of starting to wake back up to are these things actually beneficial in some way for patients? I think it's really important to know that there's no one thing that's going to be, the treatment for everything or the cure-all for everything, nor is one thing going to work for everyone. It's really important to critically think about everyone's different. Everyone has different other conditions. People have different reactions to medicines, and there's different formulations for how we even take the things that we're prescribed. So marijuana is also known as cannabis. It's a genus of plant, has a host of different chemicals, but kind of the two main chemical constituents in medical marijuana are THC and CBD. We know that THC, which is kind of more of the psychoactive compound, and CBD seems to be more of kind of the anti-spasm and kind of anti-anxiety and relaxing aspect compound. So we thought that maybe medical marijuana could help with some of the symptoms in Parkinson's, particularly tremor, dyskinesia, stiffness, insomnia, the dystonia or painful contraction of muscle, pain or weight loss. So there have only been a few clinical trials up to this point, mainly because, when you're moving from being an illicit substance that was illegal and is still kind of garnering legality in the various states, because it's not just everywhere that everyone can get access to marijuana right now. We really don't know all of the ways in which it has impact in a beneficial or negative way in Parkinson's disease. But we do know that with more time and with easing of federal restrictions, hopefully we'll be able to have more focused research, which can answer some of those questions. It's important to also note that anything, by definition, that impacts the body and changes the way systems work, whether to speed them up or slow them down or support them, that's a drug. And so to that end, medical marijuana, any of these plants act in these ways that impact our bodies. And so they are drugs that can then have both good and bad side effects. So with marijuana, we know that there's a possibility of sleepiness, of confusion, of mood changes, of psychosis, of difficulty with walking as a side effect that maybe isn't so great for medical marijuana. In my own practice, I've seen that it has been most beneficial in patients for things like spasms of muscle, for some people, sleep, for appetite and nausea. And for some people, it can help with anxiety. For other people, it can ramp it up. So I would say it's really important to always discuss with your primary doctor kind of how to incorporate any of these alternative therapies into your treatment plan. And I'd recommend that you don't just kind of go, into the void trying all the things all at once, because that can be a bit overwhelming for you and for your healthcare providers. So now I believe we're going to do some question and answer. Is that right, Dr. Gilbert?
Absolutely. Thank you so much, Dr. Stone, for that excellent introduction. I learned a ton. I'm looking forward to reviewing your slides again to remember everything that you said. It was absolutely fantastic. We are now ready for our Q&A. We have a number of questions that people submitted ahead of time that we will be asking, and we very much encourage people who are participating live today. If you have a question for Dr. Stone, you can ask your questions throughout our discussion. That's going to start now. So in order to participate in the live chat, you will have to be logged into YouTube or Facebook, and we may even display your question along with your name and your photo if you have attached your name and photo. So please be aware of that. So our first question, we have a great question from Paula, and I know this one, many people are interested in hearing the answer. So there are a lot of complementary therapies you talked about, the herbal medicines you talked about. Any chance of getting these therapies paid for by insurance?
So that's a good question. So I did a bit of research about this, and it seems that some insurances will cover some of the complementary therapies, such as massage. And I think that if you have a flex spending account, you can also buy supplements through that. And I think depending on if you have private insurance, I would say maybe inquire with them, like, do they cover acupuncture? Do they cover massage? Will they cover, your, consultation with an herbalist or a naturopath if you want to also learn more information about that? But you definitely can get coverage for spending for supplements. You might even be able to be reimbursed for some exercise equipment, things for yoga or Pilates, and you might even be reimbursed for massage therapy for sure. I think you just have to have your doctor write a prescription as well as like a medical justification. So.
Great, fantastic. So it isn't all off the table. There may be some ways of getting it covered. So that's really fantastic. Along those lines, in general, neurologists, unlike you, may be a little wary about the whole topic of herbal medicine and may not want to even broach this topic with people in their practice. I know that I've come across that, and I'm sure you have as well. Are there particular ways to find a neurologist that might be more amenable to this type of therapy than others? How would you go about seeking out this type of care somewhere where you might live?
So, there is an Academy of Integrative Medicine, and I believe they might even have a directory of, physicians who might be members of that. I always say too, you never know without asking. So when you go to your neurologist and ask how they feel about some of these things, it can be change is hard, just to kind of sum it up. And so I think sometimes, we often get siloed in our little worlds, and what we've done is the way we've done it. And it can be hard to kind of break out of that and learn something new. And so I think one thing to keep in mind when you're going to your physician is understanding that they might have been doing this or learned a completely different way. And the key is kind of that flexibility of it being an ongoing conversation, learning what they're comfortable with, learning what you want, and then being honest about that kind of, what's the word? If we're compatible in that way. A lot of times in support groups, by word of mouth, you might hear from other patients in your area. I went to someone and this is who I found, and I thought this was really great. Or if you're in a bigger center, you might have access to, an integrative health system there, or massage or acupuncturist in your system who also then might have some recommendations for you.
Fantastic. So along those lines, we have a question from Raju, who I think asked a question that maybe is on many people's minds in this discussion. Are all of these therapies, have they demonstrated benefits against placebo? So to elaborate a little bit, are these therapies sort of airtight and things that everyone should be trying? Are neurologists who sort of aren't on board, wrong? How do you think about the topic of clinical trials and evidence-based in all the different therapies that you mentioned? You did touch on this a little bit. If you could elaborate for our audience about how you think about this.
Absolutely. So first, I want to say placebo. Why that is a bad word, I don't know. Because how great is it that our mind can make us feel better without us having to take anything else? I mean, that's pretty incredible to me. And, in the words of kind of the Hippocratic Oath, the first do no harm. If I risk doing harm by prescribing something that could then cause an adverse effect versus me, having you just think that you could be better and indeed you're better, I would much rather be able to say, like, let's go this route, because that just seems to me to be a win-win. Now, as for studies about placebo versus some of these modalities, particularly in the herbal medicine realm, for the chamomile that I mentioned, for rosemary, for ginger, these are all been tried against placebo, and they have been more effective than placebo. As for our exercise, we know that with those modalities, also better than placebo. And I mean, honestly, when we think about what exercise is doing and what kind of movement is doing, and a lot of those kind of non-pharmacological modalities are doing to the whole body, they also are giving you a sense of well-being, which is then making you feel better. And I don't think we could ever separate that out, because we're complex beings. We can never separate out the ability of being hopeful something's going to be beneficial from taking the thing. We just can't. You can go for a surgery and just think it's going to go horribly, and the surgery could go just fine, and you still could feel horribly. And what do we say about that, right? So I think that there's something about this where we have to be able to understand that there might be things at play that are beyond our understanding. And when erring on that side of positivity and thinking we're going to do better, it's really important to also tap into that.
That's a lovely way of thinking about it. And I think something that can give us some food for thought. So thank you for that. We have a question from Mike, which is tied to some of our discussion about complementary therapies. Is there evidence-based clinical studies on the benefits of moderate versus intense exercise on a daily basis? Why don't you tackle that one?
So Mike, when I was doing some study, I think the key was that you needed to have at least 30 minutes of kind of rigorous exercise, getting your heart rate up to really get that extra bit of benefit. Perfection is the enemy of good. And so you don't want to just say, well, if moderate isn't going to be as good as intense, then just forget it. I'm not going to do anything at all. So I always tell people the goal is to kind of ramp up, and what is moderate for someone might be intense for someone else, depending on where you're starting as well. And so you want to start at a place that's meaningful and doable for you. And then you want to have these goals of being able to increase that as tolerated.
Very good. Along those lines, Jim asked a question. What about weight training for maintaining strength? How does that fit into our exercise goals?
I mean, I have no issues with weight training. Of course, it's great to kind of help bulk up muscle and endurance and that sort of thing too. But I do think that the idea of good kind of a good cardiovascular workout is really important. And so you don't want to weight train at the expense of not having good aerobic exercise. For some people, weight training, depending on what their symptoms are, it can be maybe something that might be a little bit more on the risky side for them. Like, and you want to make sure you have good form. You don't want to end up hurting yourself by overdoing it. So that's something where I would encourage you to either have a trainer or someone who helps you kind of navigate that as safely as possible.
Fantastic. So if someone's meant to do as much moderate versus vigorous exercise as they can, they need to throw in a little weight training with the appropriate supervision. And then there are all these complementary therapies that can help as well. How do you sort it all out? When do you consider a complementary therapy in addition to the exercise? Which complementary therapy do you consider? How do you approach this with your patients?
So for me, I think it ends up being a conversation. It's one, what are the things that's bothering someone? Because for somebody, they might have issues with constipation and nausea. For other people, that's not their problem, and they're just like sore and tight all the time. So, I'm not going to prescribe or encourage ginger and working on their kind of GI symptoms, just to the person who has, muscle spasms and tightness. I'll say, well, have you tried massage? Or can we try acupressure? Are you doing stretching? So, it's really kind of, where are you? What are the things that are most impacting your quality of life? And then how do we add one thing here? We don't want to overwhelm you. We want to start small, and you might just do a handful of things. You might do your exercise, you might get a massage once a month, and you might just have an issue with sleep and drink some chamomile tea at night. That might be all you do, and that is more than fine. And then you might be someone else who needs to do a little bit more.
Very good. We have a great question that I think comes up very frequently in clinical practice. Somebody who's interested in mucuna is also on Sinemet. Are there ways to take both? We have this question from Simone. What about taking mucuna purines along with Sinemet?
I actually had a patient who did this. Interestingly, with her, she was very sensitive to medicines. And so she actually had some nausea when she added the mucuna to her Sinemet. And didn't really notice much of a difference between the two, like adding the two together. So I would say, honestly, since they're kind of the same thing, you're kind of grabbing from the same bag if you do them together.
Okay, so probably sticking to one or the other, and not necessarily jumping from one to the other. Although I had a patient, I should say, that did do that. That had at 1, 3, and 5 she took Sinemet, and at 7 she took mucuna, and she had it all figured out. So
some people.
Exactly. Now, you mentioned some complementary therapies that have evidence that they work against placebo. You mentioned some herbal medicines that work against placebo. Are there any of these modalities that have been tried specifically in Parkinson's disease? That's a question from Phyllis. She asked specifically about meditation and relaxation exercises specifically in Parkinson's disease.
So for meditation and relaxation, can't speak specifically for Parkinson's. I know that with meditation, there have been studies, particularly not just meditation, but even prayer and times of contemplation and quiet that have been helpful. Often what they're looking at is kind of the mood aspects of Parkinson's before and after. So depression and anxiety, for example, how those things improve after incorporating one of those exercises. So that's kind of where that research has been done, more than just kind of physical symptoms, if that makes sense.
Very good. So we have a comment from Nas, who says, exercise does not help me at all. I do dance, but I feel fatigued. What are your thoughts for somebody who is just not getting benefit from their exercise?
So I think, first exercise is kind of a big grab bag. So what are you doing? When are you doing it? Is it isolated or is it with other people? And whenever you have, fatigue, we know Parkinson's causes fatigue, but there are also other conditions that can contribute to that and make that more of an issue. And so making sure we're not missing any other issues that could be contributing to that. I often tell people as well that at the beginning, when you're deconditioned, you're going to be tired. And that's just kind of until you get adjusted to and acclimated to starting a regimen and getting some endurance under your belt. And then there's just days where you're tired and you do what you need to do because you know that you should, but it doesn't necessarily have some return that you immediately feel. And so I think about exercise the way I think about eating your vegetables or drinking water. You don't always feel the immediate reaction of, oh yeah, this is good for my body, but you know that it is. And so you continue to do it anyway. But I would say for your exercise, really try to think about, what am I doing? When am I doing it? Am I doing it to its best optimization?
Fantastic. We have another question from Raju, which dovetails with the previous one. So you're trying a new alternative therapy and it's maybe not working. How long do you try it for?
I say you should give anything a couple months, without having some major, like, this is horrible for me. Give something a couple months and see how you feel. You can't know anything after a couple weeks. It's just.
Very good. We have a question from Patty, and she says, I researched and put my husband on berberine, lion's mane, mucuna, and cat's claw. Can you recommend a dosage? Now, I know you're not going to recommend a dosage because you mentioned that everyone's individual and you need to really discuss these things very specifically with a practitioner. But if you could comment generally on people who have found herbal remedies on their own and have sort of brought together a number of herbs that they're taking, what if somebody comes into your practice with this list? How would you approach that? Would you encourage them to continue? Would you encourage them to change? How do you look at these lists of herbal medicines that people have come up with on their own?
Absolutely. I think the first thing I try to do is get a feel for how long have we been on this regimen. So if it's one of those, if it's not broken, don't fix it, that's one thing. But if it is, I've investigated this and I've just started, I often encourage people to start low and slow. So you want to add one thing to your list first. You don't want to add 5 things all at once, because then you won't really know what's beneficial, what's not, what's causing an adverse reaction or interacting with a medicine you're on and you don't even realize it. And it can just kind of muddy the waters. Also, a supplement isn't created equal. So since these things are not watched by the FDA, every company that makes them, they might not be as standardized. You might not, the formulation, should you drink it in a tea versus should you eat it versus should you have it in a capsule versus should you rub it on your body? There's a lot of different ways you can get exposure to these compounds. And so I would say that my way would be kind of to clean things up and let's see, like, what are you trying to get to the root of? What's the issue that you want to be made better? And then let's see how we can do that in a kind of stepwise fashion.
Okay, fantastic. Now, Patty also asks, how does she find an herbal expert in her area, which you did mention earlier. And I'm wondering if perhaps you could provide us with the website you mentioned, and we can distribute it to those who are watching. And maybe we can take care of that after the program.
So there's a group called the American Herbalist Guild. In it, there by state are a list of herbal medicine schools kind of throughout the country. And then in contact with them, they can often let you know who have received certification, because you have to have like at least 200 hours of a kind of on-person training to then get a certificate for herbalism. You don't have a license to be an herbalist in the US at this point, like you do in like Germany or someplace like that. But that is a place where you can kind of start to find people who actually have accreditation. And it's not just, Joe Schmo who hung a shingle and who knows what might happen.
Okay, fantastic information. Thank you. We have a great question from Roger. Have there been studies to show the benefit of journaling, e.g. gratitude, or cognitive behavioral therapy for people with PD? So this is a question that brings us into a new category of complementary therapies that we haven't discussed, which are therapies of cognition therapies. And so what are your thoughts on that group of therapies?
So, for Roger, I actually didn't investigate this for this talk, so I'm not sure. I'm sure there probably has been some study, particularly for cognitive behavioral therapy. I just wouldn't be able to tell you what the results were. But I would just intuit that taking the time to journal, to practice gratitude, kind of falls under that category of mindfulness again. And it seems to me that that would definitely be something that could be beneficial. As to how that relates, I can't really speak to what the actual data would show. But that's definitely something that I'd like to add as well now in the future when I'm thinking about some of these alternative therapies. So thank you for that.
Yes, thank you, Roger, for that. We have a great question from Shannon. Should one be concerned with expiration of herbs? Do any of them become toxic if they are too old?
So if anything, if an herb is too old, it ceases being potent, and then you just don't get a benefit, for the record. So there are some plants that when they're better when they're fresh, and they have to be tinctured or turned into tea when they're right out of the ground and you've picked them. Others you can use fresh or dried. And others still you dry and you can use as tea, or you can infuse in an oil or a tincture. And that is dependent on plant by plant, and leaves versus berries versus root. So it gets very kind of complicated there. But the large takeaway is if something is old, it's just not going to work anymore.
Okay, great. That's a nice rule of thumb. So we have a number of questions which I'll try to tie in all together. So you listed a few symptoms for which you identified herbs that can be helpful. So you mentioned sleep, etc. What about, I'm going to list a few other symptoms, and if there are herbs that you might recommend for those. One is fatigue. Lots of people have been asking about that. Another is weight loss. And a third is balance.
So I'll work my way backwards. So balance, I have not seen any herbs be beneficial for that. And any of my patients who happen to be on here will know that I tell them there's no pill for balance. Like there's no shortcut to that. You must move. That is the key. And that even still with, the progression of Parkinson's, the postural instability is just something that you often start to deal with, and you have to learn to work with and work around as you progress through the disease. I wish there was something quick for that, but we just don't have it right now. So that was balance. Then you said weight loss. I don't know of any herbs specifically for weight loss. There are herbs that can help with kind of curbing appetite, of course. There are herbs that help with helping manage water weight. And helping you kind of get fluid off. But as for a plant for weight loss, I'm not familiar with that either. And then you said fatigue. So, I think the question is, what is the fatigue coming from, right? So for people who can have some sluggishness and kind of dragging, of course, ginseng is something that's often been used to kind of pep people up. Otherwise, if your fatigue is coming from, another organic reason, like you have anemia or your thyroid's out of whack, or, your vitamin D is low, your testosterone is low, where there's all these other things that need to be done. If your fatigue is coming from the Parkinson's itself, as far as I know, there's no specific medicine or herb for fatigue from Parkinson's disease itself. It's more kind of trying to help people be supported in how to manage that. I'll keep my eyes open for you, though.
Fantastic. A lot more to be learned with all our various symptoms. We actually are at the end of our time, unbelievably, for our Q&A. And so I'm going to try to get in one last question, which I know may be on some people's minds, which is, have you ever encountered a patient who was only on herbal medicines and didn't need standard therapies?
The answer to that is really no. I have had patients who wanted to be, and when I saw them, they looked to me very undermedicated, and it really kind of hurt my heart. But my role as a physician is to help kind of guide people through the diagnosis and the management of their disease, not to beat them over the head with what needs to be done, because ultimately it's your body, it's your health, and I'm here to help facilitate what you want to happen. And so, I had patients who were very, very adamant about not starting pharmaceuticals for their Parkinson's, and they only exercised or they only changed their diet. And yet, and still, they said that they felt fine, they felt good. But when you saw them, you saw they were still very stiff, very rigid, shaking uncontrollably, having falls. And so I still tell people I would not necessarily encourage that. Now, for my patients who had very minimal symptom and didn't want to take medicine, wanted to get really active with their exercise, wanted to increase their modalities of complementary therapies, and maybe try some herbal meds for their non-motor symptoms, that's kind of a different scenario. We're not talking about trying to treat their physical symptoms with these non-pharmacological therapies alone.
Yeah, I've had very similar experiences, and so it's a matter of knowing your patients and counseling wisely. And it sounds like we've had similar experience with patients like that. So thank you for that. We are unbelievably at the end of our time, so I wanted to thank you, Dr. Stone, again for a wonderful presentation, for all the wonderful answers and all of the information. I know I learned a ton, and I want to thank everyone for their active participation in today's discussion. We obviously did not get to every question, so I apologize for that. There were just way too many coming in, and I had to cherry pick the ones that covered the most topics that other people were interested in. So I apologize to the viewers who did not get their questions answered. And if you know someone who missed today's program, if you joined late, if you want to watch this again, if you want to take another look at the slides and see the presentation that Dr. Stone gave at the beginning, this recording will be available later today on our YouTube channel. So look out for that. And don't forget to subscribe to APDA's YouTube channel to watch new videos and live broadcasts. So for additional information, for resources, please visit our website at apdaparkinson.org. I want to highlight our next episode of Dr. Gilbert Hosts, which will be taking place on Friday, September 17th at noon Eastern Standard Time. I will be hosting Dr. Lisa Schulman at that time, and we're going to do a Q&A about research participation in Parkinson's disease. We'll address issues such as what types of PD research need participation from people with PD, what is a clinical trial, should I join one, how can I find one to join, and you'll be able to ask your questions live in the same way as today's session went. In addition, a person with Parkinson's will be joining us who participated in research, so he will be able to share his experiences with you and hopefully inform your decisions about clinical trials as well. So you can register for that session, as well as many other virtual programs, using our virtual calendar. And you can go to apdaparkinson.org/events, scroll to September 17th, and you can register there for our next event. If you enjoyed today's program, we hope you'll consider supporting APDA with a donation, because with your help, APDA can deliver more programs and services like this one. So thank you so much, everyone, for joining us today. Thanks again to Dr. Stone, and we hope to see you soon on another APDA program. Have a wonderful afternoon.